Hi guys, it's Dr. Kid here. I'm currently a doctor that works at a clinic that specializes in adult ADHD. And in this video, I want to go through all you need to know before you start Ritalin, including how does it work, how to use it effectively, what are the key side effects to look out for, and how does it compare to other stimulants for ADHD. So what is Ritalin? Well, Ritalin is a stimulant medication that's used to treat the symptoms of ADHD. It's actually a brand name for a generic chemical known as methylphenidate, and it comes in short and long-acting forms. So how does it work? Well, in patients with ADHD, the dysfunction is thought to be in an area of the brain known as the prefrontal cortex, which is an area at the front of the brain. And this area of the brain is responsible for functions such as planning, attention, memory, organization, and emotional regulation. Ritalin increases two chemicals in the prefrontal cortex known as norepinephrine and dopamine, and this is thought to improve executive functioning. So what dosages does it come in? Well, the short-acting version, there's only a 10 milligram tablet, while the long-acting version, there's a 10 milligram, 20 milligram, 30 milligram, 40 milligram, and 60 milligram tablet. Some patients take short-acting tablets only, and they'll take multiple tablets a day, while other people will take long-acting tablets, and they'll only be taking it once a day. With the short-acting tablets, the maximum dose typically is up to 60 milligrams a day, and with the long-acting tablets, its maximum is usually 80 milligrams a day. However, there are some patients that take both long-acting and short-acting tablets. This is because some patients, the long-acting tablet does not last the entire day, and they need a short-acting just to tie them over for the rest of the day. So what are the side effects of Ritalin? Well, the common side effects include headache, nausea, dry mouth, loss of appetite, and insomnia. Some of the more rarer but more serious side effects of Ritalin include heart attack, stroke, and precipitation of psychosis or mania. So who should not use Ritalin, or what are the contraindications to Ritalin? Well, the patients that should not use Ritalin include patients that are pregnant, have glaucoma, have a history of hypothyroidism, have a history of tic disorders, have a history of severe anorexia nervosa or severe psychotic disorders, or concurrent use with a medication known as monoamine oxidase inhibitors. So what's the difference between Ritalin long-acting and Concerta? Concerta is also methylphenidate, and it's also a long-acting version. And it's logical to ask sometimes, what is the actual difference between Ritalin long-acting and Concerta? Well, both medications are actually quite similar, but I'm going to show you this graph that shows tiny differences where Ritalin long-acting has a slightly higher peak concentration, and it also has this double peak compared to Concerta, which tends to be a bit more smooth. So how does Ritalin compare to the other stimulants such as Vyvanse or dexamphetamine for ADHD? In my personal experience, some patients respond really well to Ritalin and not to another type of stimulant medication, while other patients will respond really well to another type of stimulant medication and not Ritalin. So for me, there's not really one stimulant that's better than the others, but it's good to have a range of stimulants that I can try for different patients and use what works best for my specific patient. So that's my review of Ritalin. If you found it helpful, don't forget to like and subscribe to the channel. If you're interested in other ADHD medication, see the links in the description below for some other videos that I've done, and I'll see you in the next video.